how would you sort of assess and characterize, our care for narcolepsy in terms of the adolescent and children population? Where do we excel at? Where do we not excel at?
I think that I, at least at Boston Children's Hospital, have the fortune of working with some very, very bright, very knowledgeable physicians who do a wonderful job of managing the medical aspects of the sleep disorder. And with the new medications that are now available for these patients, I think that we're getting better and better care at symptom management. The challenge, as we talked about in the paper, is that the American Academy of Sleep Medicine has these wonderful guidelines for the management of hypersomnia disorders, and they specifically mentioned that there's just not enough work done thinking about improving psychosocial care for this patient population. Again, that makes sense. We spent all of this time up till now trying to make sure that we medically manage this, which is a priority. And now that we have almost the luxury of being able to take a step back and say, all right, what about everything else? That's, I think, the next forefront of better whole patient care for our patient with narcolepsy. Our providers becoming more cognizant and thinking more actively with patients about, okay, so you're not having cataplexy now. That's wonderful. What else is going on in your life? And that's the stage I hope we get to soon.
Are there ways in which that we as a society can, potentially prevent narcolepsy at its earliest stages? Are there things in which we currently don't do that we maybe should be implementing at earlier stages?
Well, narcolepsy, the disorder itself, I don't think that we have the capacity to prevent the development of that disorder. But what we can do is do a better job of preventing the consequences of narcolepsy disorder from being so impactful. And this is where having more consistent screening practices when somebody is treating a patient with narcolepsy for other issues like depression or an anxiety-related disorder or social struggles. These are things that can be built in rather than what we do primarily now, which is, for example, we often screen for excessive daytime sleepiness, but leave it there. So there is an opportunity to prevent the consequences from narcolepsy rather than the disorder itself.